Cities are places where we can look closely at the everyday phenomenon of life because there's so much of it happening around us. MAPS Core is meaningful, active, productive science and service to community. And this is a program that is developing youth, training youth, and employing youth on the south side of Chicago. Their job is to identify every business and organization open and operating for the public, offering goods, services, or jobs that we can use to be a healthier community and more vital community. Community RX is an innovation that's connecting the data that the youth are collecting to healthcare. Community RX injects information into the doctor-patient encounter through the electronic medical record. And the data engine for Community RX are the youth, the MAPS Core program.
Good evening, everybody, and thank you so much. Kate's work in Lakeside is a good transition, I think, to describing some of the work we're doing under the rubric of something called the Urban Health Initiative at the University of Chicago. And when I think about, we were here about big data. I like etymology, so what's the etymology of the word big? It's actually kind of elusive, but one of the sort of 15th or 16th century uses of the word, which sticks with us today, is generous. So I think the project we're talking about, I'm talking about on behalf of many, many people involved, both at the university and the community, is the idea that we can use data in a generous way to build our relationship between the university and the community and to lift people's lives up. You asked about what are we doing about quality of life. And the idea for this actually came from early engagement with community leaders on the south side of Chicago. We opened the doors, we said we have some resources to do some work. That is science, because that's what the University of Chicago does well. But we want to do our science in a way that is of benefit to the community. What ideas do you have? And interestingly, people didn't say you should work on diabetes or you should work on cancer. People said, if we're going to work with you on science, you should do your science in a way that generates data we can use and gives us a deliverable real fast. And people said, and I never would have thought of this on my own, although it makes a lot of sense, you better figure out a way to employ youth. You better figure out a way, if we're going to do science with you, that you find a role for our kids to learn science, to get exposed to the university, and to understand how knowledge can make lives better. That was brilliant. And third thing people said, and I'm a physician, we came from the medical center, was your definition of health is not my definition of health. And what that meant was, we said we're interested in an empirical definition and being able to monitor health over time. How do we get there? And what that led us to was a question of, if we're interested in working together to transform the health and health opportunities for people on the south side of Chicago, and by the way, all indicators are that if you grow up on the south side of Chicago, you have fewer years of life, you're going to be sicker, you're going to have less access to health care. Those are the realities. If we're going to try to transform the situation on the south side of Chicago with respect to health, what do we have to work with? Now, we can take a deficit-based view, and this is what intrigues me. Actually, Ralph Ellison, who writes Invisible Man, spent a year actually at the University of Chicago in 1961, talked about the invisible and the unvisible. And I've come to realize that what I'm interested in is the unvisible. Invisible is what our eyes can't see. We need our glasses, we need our microscopes, and there are lots of people here who do great work about the invisible. But the unvisible to me, and this I think relates to some of the ideas Kate was just sharing as a sociologist, social scientist, is the things we can't see because of the social, the psychological, the emotional, the prejudicial barriers that prohibit us from seeing. We don't want to look down there. We avert our eyes, or we choose to see a deficit view of the world. And it is true that there's unemployment, and it's true that it's resource poor. But if we're trying to build something, knowing what we don't have to work with isn't that helpful. So we decided with the community that what we needed to do was identify every single asset we could leverage for the purposes of better health and better vitality. And we had to figure out how to use the kids, so we employed kids, put them in teams with college students here from the University of Chicago. They walked up and down every single block of every single street. Now they've done this 5 years running with a map app, a little phone-based application. And they now, we could share our data with Kate and the Lakeside Project. We now know every single business that's operating in all of those communities that you see in the map here. And we know which ones are new and which ones are old. We've put the invisible on the map, and now we're able to connect that information up to real people so they can use it to better manage their health. So it's not really big data, I don't think, in the true sense of the word, but the bigger our data becomes, I think the more we have to worry about what's not in our data. And it's harder and harder to tell. The bigger the data gets, it's harder to tell what's not there. And that interests me. But I think, one extension of like the consumer-facing extension of the 311 example is imagine that the person like I who called actually can see the problem resolved. And whether I see it because you put in your SLA that the problem has been resolved, or I see it because there's no longer a pothole in the street or the street light, is back on. It's that, to extend your medical model idea, the biofeedback, the ability to take big data to identify, maybe prevent, or early response to a problem is the first part. But then how can we use the data to actually feed back to the real human beings who are really behind all the data? And I would say, one of the experiences we've had working with the youth in MAPSCORE has been, which is the Meaningful, Active, Productive Science and Service to Community, the mapping project, because everything needs an acronym, is by taking the data they're collecting and connecting it up to the healthcare system where real patients are getting this information on prescriptions every day. The kids also know they're accountable for the data, right? If the real world is gonna actually use the information, like if 311's really gonna tell somebody about the pothole I'm calling in and somebody's gonna really fix it, and there's that extra layer of accountability that I think influences whether people are gonna call 311 the next time, or whether a kid next year is gonna sign up for the program. I don't know that I have it quite fully formed, but this notion of the people behind the data and the accountability for the data, the integrity of the data is really important in terms of how we make conclusions.
Tools that we have access to.
I think, in healthcare, you just described a really, a big trend in healthcare. So the insurance companies, all of our insurance companies are using our data about our claims to hotspot us. And they're looking to see which one of us is about to cost them a lot of money. Okay, and they can do this, and they can do it very effectively. It's the predictable nature of our healthcare spending is very, very high. But then what? So let me just give the example of a patient here on the south side of Chicago, nobody in specific, just a general example, who gets hotspotted by the insurance company. So now what do? Somebody from the insurance company calls up the patient and says, "Hi, I'm really concerned about your health, and I want you to go see your doctor." Well, we don't like advice from our insurance company, first of all. So there's a problem there in sort of who's delivering the message, because we sort of question what their priorities are. But let's say we could get that message to the patient's doctor. And now the doctor calls and says to the patient, "You know what? I've been looking at your records, and I'm just worried that things are going in the wrong direction. Can you come in to see me?" And so that's fine, that works, and there's technology that's doing this, and the patient comes to the doctor, and the doctor says, "Your diabetes is really out of control, and I think there's some things we can do to keep you out of the emergency department, but you've got to really lose weight, and you've got to exercise, and you've got to take care of your feet, and you've got to take your medicine. Bye-bye," and the patient leaves. And the data we have on the other end, especially in less resourced communities, about where the patient's going to go to do those things is awful. I mean, I'm sure there are people in this room who are wondering, why do we have kids walking up and down the street mapping businesses? Haven't you heard of Google or Yelp?
I think that's what I said to you when you first.
I think you did, and pretty much everybody has. Is there anyone from Google in the room? Okay, I know you're here somewhere, but I'm sorry to say, but the data from the youth, and my colleague Jennifer McLarsky, who is in the audience, is a lead author on this paper, the data from the youth are in every sector of our economy, not just healthcare, 30 to 40% better than the best available data from the commercial sources that everybody's using. Why? We have an invisibility problem. Why aren't all our businesses and social service organizations, and why aren't they on Google? Why aren't they in the mainstream places people go to look for information? Well, these are important questions that social scientists can help us answer. But it reveals the data problem. We've predicted the bad behavior, we've delivered the message, and now we just push the patient off the cliff. Or we say, you know what, there's a place where you can go to lose weight. It's called the YMCA, and I'm going to give you a referral there. But there's a 40% chance when you get there, it won't actually be there. That's the quality of data we are giving people. So at some point, when you're making decisions about sort of where to put your next dry cleaner or what investment you're going to make, having data with 80% certainty or even 60% certainty is fine. But if you're actually going to take those data and give it to a real person and expect that person to act, to change their behavior, and they go there on their last dime and they show up and it's not there, or it's there and they're not eligible, or they're not allowed, or they can't get in the door because there's no ramp for the wheelchair, then all those big data have failed us. Huge waste of time and money and effort. So now I'm getting all riled up. There was an interview candidate today in my office, somebody we were trying to recruit to the University of Chicago, and he's from the East Coast, from one of those great peer institutions out there. And I said, you know, truly, the thing I'm sure we can deliver for you here is the interdisciplinary opportunities and the compact campus with the world's best college students. And you take that combination of things and then you put it in this incredibly, I see it as rich, I'm an asset-based person, but this incredibly rich, diverse community. And if we think of the community as the south side of Chicago, 34 communities, 800,000 people, 95 square miles, we have a microcosm really of the country at least. So I want to say that one of the most greatest joys of being a faculty member at the University of Chicago is that interdisciplinary opportunity. And I find that for me, I've worked with such a variety of people. Every time there's a different problem, there's a different team of people to work with. And that's just a tremendous asset of this place. And I can't underemphasize the brilliance of the people we've worked with from the surrounding communities. People, community practitioners, people who lead community development organizations, people, and again, back to Ralph Ellison, who talks about the ingenuity of the invisible person, right? You have to figure out how to move around. No one pays attention. There's a great deal of resilience and creativity and commitment, and although there are town-gown frictions, just like on every campus in every urban area in the world, I found a great deal of generosity and ingenuity in the community. And I think that we ought to consider that part of the interdisciplinary nature of the work we do, and one of the great assets of the university.
Large community problems.
Well, so I guess the first time we met, so Brett had something to do with OpenTable.com. I'm sure you've heard of it. And you know, so one of the dreams is that connecting people to the programs, the services, the resources, the things people need to be healthy every day is as easy as it is to make a reservation for dinner. Why isn't it? I mean, OpenTable's brilliant, and I love it. I use it all the time.
You can keep on going.
Yes, Brett, okay, I'm just gonna tell you all a secret, because it's getting late. It's practically cocktail hour. I think we might have missed it. Brett said that if I meow, that he would give me a big present. And so what I'm going to do is ask Brett to help me work on the idea that connecting people to the programs and services they need is as easy as it is to make a reservation for dinner. And so that's what you have to do.
I think I'm in trouble now.
In front of this whole audience of people.
We weren't supposed to play the meow game during the panel.
We were getting silly backstage. But, so that's one vision. I mean, the other is seriously, and I'm not a businesswoman, I'm a physician, but I believe that the work we're doing, we have to find sustainable solutions for the work that we do, or else it's one-offs. It was a good period of 5 years, and then it's gone. And if we are able to figure out a way to generate savings for the healthcare system by more efficiently connecting people to high quality information about how we can all take better care of ourselves, and we can use those savings to employ youth to become the data scientists of the future, and we one day have a real health information technology company, I guess I might have to call on you for that too, here on the south side of Chicago, maybe in Lakeside, where the kids who are joining up and doing the work with us, it's hot in the summer and walking up and down the streets, can see they work hard now and they show leadership that they're gonna go to college and they can come back here to the south side of Chicago and have a great, exciting job and career. I mean, that for me is the big vision. And will it ever come to be? I don't know, but we gotta think big.